You walk into your therapist's office after a long workday, raw and heavy with emotion, asking yourself, can I even go on? Then you notice the dark circles under her eyes, the exhausted expression on her face, and the weight of too many other people's worries pulling her shoulders forward. And you wonder, how can she possibly help me? Across the nation, 93% of mental health workers have said they've experienced burnout. Since 2020, we have seen a national rise in the need for mental health care, yet our workforce continues to shrink. Meanwhile, nearly half of this workforce reports considering leaving the field entirely. I once faced a similar dilemma as an entry-level community mental health caseworker. At my first job as a college graduate, I pushed through a 50-hour caseload while using my own car for home visits. I lived on a $19 per hour wage while experiencing a chaotic work environment during a worldwide pandemic. My experience improved at another employer, but that did not last long because I dove headfirst into graduate education. During my clinical hours, I quickly realized that the idyllic, calm presence of a therapist was much more out of reach than it seemed. I became exhausted. I was sleeping on the couch between sessions, skipping meals, struggling to focus, and feeling depressed. I felt guilty and inadequate. When I went to my supervisor for advice, she asked, "Have you been doing self-care?" And it didn't matter if I was, because self-care alone cannot change the systems that create burnout. In 2022, the average career length for a mental health professional is a short 10 and a half years. Comparatively, a doctor's career lasts 25 years. Therapists are thirsty, and they are drinking from an empty well. Our country is experiencing a mental health crisis, and these skilled professionals are opting out and choosing other careers. Some of my colleagues have left the field to become life coaches, bank managers, real estate agents, and teachers. And these professions allow them to use their strong people skills while still prioritizing their own emotional needs. But when we first started out, we were willing to invest our time, money, and energy to be mental health professionals because we wanted to change people's lives. As a transracial adoptee, a child of divorce, and survivor of child sexual abuse, my life needed a change. When I was 17 years old, I told a clergyman about my abuse. He said he would have to report it. When I got home from school the next day, I saw a car I did not recognize parked in my driveway. The social worker asked one question that changed my life. What would you like to see happen? She gave me power. She asked me something nobody had ever asked me before. She asked me what I wanted. I became a therapist to empower people with experiences like me to change their lives like I did. I love my work, and I want to stay in this field, and the answer to keeping more therapists from leaving the field is more simple than we think. Therapists are simply humans who need compassionate working conditions that enable us to empower our clients. Therapists need therapeutic workplaces. The design of a therapeutic workplace should be just that. Right now, the typical design of a community mental health practice often involves large caseloads with only a few moments between appointments. It also involves documentation, case consultation, and other organizational tasks. A therapist experiencing burnout can be emotionally distressed and lose their ability to connect and feel empathy. The therapeutic relationship is the #1 contributing factor to positive client outcomes. The therapeutic relationship is like an orchestra playing harmoniously as the client and therapist come together. Healing is the symphony. However, burnout is silencing the music. Research has shown that when we reduce practitioner burnout, we create a ripple effect of positive outcomes. Clients are less likely to return with the same issue, and clinics will see lower employee turnover rates. The solution to burnout is through a human-centered workspace. Companies use human-centered designs to start wellness programs that include on-site gyms, meditation rooms, and more. But such purposeful wellness is rarely seen in clinical practices. Currently, the community mental health model is based on productivity. And the solution to this productivity-based model is to introduce a design where a therapist can rejuvenate after long sessions. It also includes peer-based mentorship and designated areas for clinicians to quietly retreat. It includes access to mental health services for themselves, smaller caseloads, more time between sessions, and fewer restrictions on how we prepare paperwork. I once worked in a clinic where a senior therapist led group conversations in addition to supervision. We had an open dialogue about our experiences on the job, challenges faced by clients, and expressed our emotional needs. We developed a better work-life balance, built better relationships, and became more effective with our clients and other team members. We had access to wellness-driven spaces that included a full kitchen, a room with cozy chairs and low lights, and an open space where movement, collaboration, and inspiration could take place. We had a place to step away from the emotional demands. This clinic also engaged clinicians in monthly on-site yoga, meals, caseload caps, and a partner clinic specifically to oversee the mental health needs of clinicians. As a human-centered discipline, we have focused on caregiving and neglected our own caregetting. You walk into your therapist's office after a long workday, raw and heavy with emotion, asking yourself, can I even go on? Then you see the hope in her eyes. The expression on her face is open and content, and the couch across from her is warm and welcoming. You sigh, she smiles. You plop onto the couch and say, you won't believe the day I just had. And you know she is fully present to help you. Thank you.